introduce you to Sivan. Sivan says it feels like something is sitting on her chest. She says her heart is beating fast also. She's weak and tired. She's very short of breath. And look at that leg. Abby is consoling Sivan and says she should see a doctor about her symptoms. Sivan goes to the hospital with Abby.
This ain't a song for the broken hearted. A silent prayer for faith departed.
Dr. Seaton runs an ECG and concludes that Sivan suffers from heart failure, where the ventricles don't pump enough blood to meet her body's needs. Dr. Seaton prescribes Digoxin. Digoxin can also be prescribed for atrial fibrillation and atrial flutter. Digoxin is a cardiac glycoside that increases contractility of the heart by inhibiting the sodium-potassium ATPase pump, allowing more calcium to be available to bind to protein troponin C. Digoxin increases cardiac output, which is the amount of blood pumped by each ventricle per minute. This creates a positive entropic effect.
Digoxin decreases heart rate and atrioventricular conduction speed. This is a parasympathomimetic action, which decreases sinoatrial firing rate and conduction velocity of electrical impulses through the atrioventricular node, also known as negative dromotropy. Variables that affect cardiac output: the degree to which myocardial fibers are stretched before contraction when the chambers are filled with maximum capacity of blood, and the pressure in the aorta that must be overcome for blood to be ejected from the left ventricle. Medical people call it preload and afterload. While Sivan is in the hospital, the doctor can give either an IV loading dose, which is 3 divided doses. The first one is half of the total dose. Second is every 6 to 8 hours. Or an oral loading dose, where the first one is half the total loading dose and the second is a quarter loading dose every 4 to 8 hours. The oral maintenance dose is 3.4 to 5.1 micrograms per kilogram per day. The doctor will make the dosage decision.
Nurse Feeney teaches Sivan to take her apical pulse for 1 minute before taking Digoxin. If the pulse is less than 60 beats a minute, take again in an hour. If still less than 60 beats per minute, call the prescriber and note the rate, rhythm, and character of the heartbeat. To evaluate the therapeutic response, if the digoxin is working correctly, you will see a decrease in weight, edema, pulse, respiration, crackles, and an increase in urine output and serum digoxin levels of 0.5 to 2 ng per milliliters. Nurse Feeney will teach Sivan to notify her doctor if she has a loss of appetite, lower stomach pain, diarrhea, weakness, drowsiness, headache, blurred vision, rash, toxicity showing as yellow-green halos, and depression. She will also teach Sivan not to stop taking digoxin abruptly, and she will need to take it exactly as ordered. She will be using one brand consistently. Digoxin should be stored away from light. Sivan will contact her doctor if she is planning on becoming pregnant, as digoxin is a pregnancy C category drug. It can cross the placenta and be transmitted through breast milk. Nurse Feeney will also teach Sivan that she needs to stay away from flaxseed and psyllium, as they will decrease the digoxin levels, and always stay away from sodium. Avoid using St. John's wort or any over-the-counter medications, as well as herbal supplements like ginseng, as it will interact with absorption. Antacids and cholesterol-lowering drugs will decrease the absorption of digoxin. Aloe causes potassium excretion and increases the patient's risk for digoxin toxicity.
Sivan is out of the hospital now and is picking up her prescription. Pharmacist Ryan explains.
Absorption rates for every medication route is different due to digoxin's low serum protein binding power. Tablets have a 70% absorption rate, whereas capsules and elixirs have a 90%, and IVs have a 100% absorption rate. Typical half-life for digoxin is between 36 hours to 48 hours. 30% of digoxin is metabolized in the liver and 70% is excreted by the kidneys in original chemical form. Therefore, patients should have good renal function while taking digoxin. Digoxin is absorbed in the liver and small intestines. It is distributed in the lean body tissues. Digoxin has a protein binding effect of 20 to 30%. Medications that prevent potassium excretion from the kidneys or increase serum potassium levels, such as spironolactone, potassium supplements, and ACE inhibitors, may cause hyperkalemia, which reduce the therapeutic effects of digoxin. Ischemic conditions of the heart inhibit the sodium-potassium pump, therefore enhancing sensitivity to therapeutic effects on digoxin. Double bradycardia effect will occur. Swan is back to have her electrolytes, renal functions, and therapeutic digoxin levels monitored and to discuss her progress with her doctor.
White syndrome. Digoxin side effects may include dysrhythmias, hypotension, bradycardia, atrioventricular block, blurred vision, yellow-green halos, sensitivity to light, double vision, nausea, vomiting, anorexia, abdominal pain, and diarrhea. Possible life-threatening toxicity may be caused by diuretics, certain antibiotics, thiazides, azole antifungals, and corticosteroids. Increased digoxin levels can be caused by propanthyline, quinidine, verapamil, amiodarone, anticholinergics, diltiazem, nifedipine, indomethacin, increased bradycardia, beta-adrenergic blockers, antidysrhythmics, increased cardiac dysrhythmia. Risk sympathomimetics, lowered digoxin absorption can be caused by antacids, pectin, cholesterine, metoclopramide. Lowered digoxin level can be caused by steroid agents, cholesterine, cholestyramine, metoclopramide, and amiloride. Talk to your doctor today to see if this drug may be right for you.
Now Savon can live a normal life thanks to digoxin, except for her french fry addiction. That has to go.
This is your heart, it's alive, it's pumping.